has to come up then every flu season. How effective is this year's flu vaccine?
We don't know what ours is going to be this year, but if you look at kind of a projection of what it'll be, the CDC and my folks and myself personally think it's likely going to be around 30%. But having said that, it is always better to get vaccinated than not to get vaccinated, because any degree of protection is better than no protection at all. That was real. And that's the reason why we put so much investment. I'm actually cautiously optimistic, but I am optimistic because it really is a scientific challenge of getting a vaccine that would induce a response against the part of influenza that doesn't change from year to year. Influenza is a relatively unique virus because it tends to mutate a lot, unlike other viruses like measles. The measles I got as a child is the same measles that's in the vaccine now, decades later. With influenza, that's different. So
patients seek care at the NIH as well.
Yeah.
What sort of preparations are underway there?
Well, I mean, it's not going to be a home run first time at bat. So it's not going to be now we have a universal vaccine, now we don't, and now we do. It's going to be universal influenza vaccine 1.0, which may be 4 years, 5 years. And then there'll be one that'll be even better until the point, who knows, 10 or more years when you actually have one that you can really say is a true universal vaccine. But it will be measured in years, not decades, but in years.
The government shutdown affect the research at your institute? You've been through this before.
Yeah.
Well, how do you prepare?
The effect that's from a practical standpoint is that when you're dealing with science, you have experiments that have been going on for months, if not years, and then all of a sudden you got to stop. You can't do that. You can't push the pause button on an experiment when you inject an animal with a particular substance to see what the response is, and then you have to go home for a week, 2 weeks, or 3 weeks. So it's really quite disruptive to the science, number one. And number two, it's very demoralizing to the people that they have to stop what they're doing when they're doing it because they want to help people. That doesn't work well. September. That was destabilizing because, just like you said, we had to go in and draw. I mean, obviously, you never want to put patients in any jeopardy. So what halts and pauses and stops is that if you have a patient in the hospital, I have my own patients in the hospital, we still take care of them. We don't say, by the way, government closed, clinical center is out. But what you don't do is you don't admit new patients into a protocol. So
Friday at midnight. What are you actively doing right now at your institute?
People are starting to think about freezing down their reagents that they were thinking about using on Monday. They can't use it on Monday if we shut down. So you don't want to freeze it because you don't want to freeze it unnecessarily if we don't shut down, but you got to be ready to be able to do it at 1 o'clock in the morning before the next deadline comes. So it's a scramble. So if you would ask me to pick out one word what's going on at the NIH right now, it's a scramble to address the possibility that we're going to be shutting down.
Perhaps we'll have to